Latoya with Because I'm a Nurse, and today we have Dr. Michael Hyland to come in and talk to us about nurses and nurses' workplace injuries. Dr. Michael Hyland has been a physical therapist since 2012. He graduated from the University of St. Augustine Health Sciences, right? And they had a really cool manual physical therapy program that he went through there. He is in a ton of organizations, namely the American Physical Therapy Association and also the Oklahoma Physical Therapy Association. He does specialize in geriatrics and Parkinson's disease, and he has a couple of cool certifications, right? And we'll talk about those here in just a minute. He also is married to the wonderful Julie. He has, is it two sons or two?
We have a son, 2 daughters.
A son and 2 daughters, and they have a baby on the way. So congratulations. Was it Wednesday, right?
Wednesday.
Wednesday. Coming up. So, Mike, real quick, tell us a little bit more about your certifications, because they are like really cool.
Sure. So they sound fancier than they are, but one of the specialty groups in the American Physical Therapy Association is called the Academy of Geriatric Physical Therapy, which actually I might be not up to date. I think they actually changed it to APTA Geriatrics just in the last few months. But anyway, regardless of that, they had a certification program called the Certified Exercise Expert for Aging Adults. Okay. And essentially what that is excuse me, basically a gigantic toolkit of assessment tools, treatment ideas, techniques, but it's specifically catered to the geriatric population and particularly people with multiple medical issues. And who doesn't?
Yeah, we have such a need for that.
Yes. So that's a pretty big certification in terms of how many people in the U.S. have done it. But as far as locally, I'm the only person around here that has that.
Oh, really? That's
yes.
amazing.
At least in the Tulsa area. Yeah.
That's awesome. And then you have for Parkinson, is it LSVT?
Yes, LSVT big. That stands for Lee Silverman Vocal Treatment. But anyway, it was a speech therapy program. It was originally called LSVT Loud. Then a PT helped to develop that into a PT program called BIG. The whole principle behind that is large amplitude or big movements and high intensity. So it's a high intensity program. It's 4 days a week for 4 weeks. So it's not only intense in how you do the exercises, but how often you're doing them. So it really is a great program because it really focuses on helping people with better movement, getting them moving again, exercising, which is difficult with Parkinson's, and also really helps them with other aspects of life too. Exercise helps with psychological and emotional and all those other aspects of the person.
Kind of help prevent those steep declines and have more of the plateaus and relapsing remitting.
Exactly, and one of the things too that I love about the program is that it is adaptable to people that have basically all stages of Parkinson's, whether it's early onset or somebody who's had it for multiple decades even. People can do adaptive versions of the exercises, lying down even, or seated, so it doesn't have to just be standing, which that's how they're originally designed. But
that's awesome.
Yeah,
fantastic.
It's a great program. Yeah.
Okay, awesome. So I have been looking up, and as you know, nurses are the most injured people in the workplace. Of all the workers, nurses end up having the most injuries, which is, kind of strange. You would think we know how to move our bodies and that we would know how to prevent this, but we really don't. So this conversation is super important. Another important factor is that the median age of nurses is 50, which I could kind of see that happening when I went to nursing school. It was myself and Stacy, and we were in our 20s, and everyone else it was maybe their second career, or they had been out of work because they were taking care of their children. And I think Nancy was like 50 or 60, which is amazing. We're in nursing school. So with that said, nurses age 35 to 64 account for more than 60% of workplace injuries for nurses. And the nurse age group with the highest percent, which is 27%, is nurses aged 45 to 54. And we know that most of those injuries kind of occur in our trunk, and they're musculoskeletal in nature, occur in the back of the trunk, and are caused by overexertion and lifting. When I heard that term overexertion, I kind of thought of like being tired, but could you explain to us like what overexertion really means?
Sure, I'd be happy to. Honestly, when I first saw the term overexertion, when you wrote it down, that wasn't a term that I would normally like just jump to with back injuries and things like that, but it really does make sense if we can break it down a little bit. So as I thought about it, if you're lifting a load improperly and that it's too much mechanically for the muscles in your back to handle, or back and core, then by definition that's an overexertion because there's more force or load than the muscles can handle.
Oh, that makes perfect sense.
Right, so anyway, there's basically not enough muscle power to overcome the force of the load that's opposing them. So when that overexertion happens, something has to give, right? So it could be your discs, it could be muscle spasm, it could be, and I even wrote this down in extreme cases. There have actually been like, competitive weightlifters that have literally just shattered the spinous processes in the back.
Oh, that sounds awful.
Yeah, just literally that the muscles are pulling so hard and just pulled the bone. Yeah. So that's basically what overexertion is in a nutshell. Just kind of you can't handle the load and something has to give.
I see. Okay, so that's important to kind of, I think, like to just watch yourself and watch your body. So if you start feeling something that feels uneasy, that you may want to stop because you may overexert and cause an injury.
Mm-hmm.
Okay, so we've all been like every year we go to the little fair and we get taught how to lift and we sign a paper saying we know how to lift. The only thing we remember is to lift with your legs, right? That's not good enough. So what else do we need to do and know to lift properly?
Yeah, and lifting it with your legs is definitely important, so don't discount that. However, I think what the missing piece is for a lot of people is how you're lifting. Mm-hmm. Or how the load is carried, I should say. Mm-hmm. So if you're squatting down to lift up something, let's say a box, you do want to lift with your legs when you stand up, but what maybe the missing piece is that box should be held as close to your body as possible. Mm-hmm. So you squat down to meet the load, pull it towards yourself, mm-hmm. and then stand up. And keeping it close to you is what protects you. Okay. Lifting with your legs does too, but bringing it close to you protects you. The reason that is because basically, if you think of the mechanics of like a seesaw, for example. Mm-hmm. If you're sitting on the far end of a seesaw, there's nobody on the other end. You're going to be sitting on the ground.
Yeah.
And that distance from where you're sitting to that pivot point in the seesaw, you can think of that pivot point as being like your core, your low back, mm-hmm. or your middle, wherever it is. And that point where you're sitting would be the load you're trying to lift. Mm-hmm. If it's really far from the center, mm-hmm. there's a huge force keeping that load down. Oh. If you have that load, let's say you're sitting toward the middle of the seesaw, even if you were on one side of it and there's nobody else on the other side, you would probably be more likely to bounce up and down, make some movement happen. You wouldn't be sitting all the way down on the other end, right? In other words, it would teeter a little bit. Yeah. But that force is so much less because the distance is so much less between the load and the pivot point. That's called a lever arm. So if you hold your loads close to you before lifting and while carrying, that's going to protect your back. Okay, so even before you start to lift, you want to get it as close to you as possible and then attempt to lift and make sure you use your legs. Right. And that includes people as well. I mean, if you think about proper transfer techniques, even gait training for like a therapist, for example, you're not standing 2 or 3 persons lengths away going, excuse me, you're right up against them, mm-hmm. hand on the shoulder, hand on the belt, and when transferring, you may be right in front of somebody and you're right up against them, mm-hmm. literally. And if that person were to fall, that's really how you would arrest the fall most safely for you and the person involved would be to literally have them pulled as close to you as possible, mm-hmm. and either lower them down to the floor or a seating surface. And so it's the same principle. You keep the load as close to your body as possible.
Okay. I think that's important because I think we forget about that. Okay. The next question is, nurses are also high risk for slips, trips, and falls. What's a good way to fall? Is there a good way to fall? And if there is, what is the best way to fall if you're going down?
And it's a hard question, but I mean, there is an answer to that, but it's tricky because you can't always plan how you fall. If you know, I gave the example of slipping on ice. I mean, it can happen so fast you can hardly blink.
Yes.
So there are some cases where you probably can't fall right.
Yeah.
But if you can see it coming, where you're losing your balance because you trip over an object, you know, like a wire on the floor or something like that, or even if it's water but you're falling forward, that's probably falling forward or sideways is probably where you could control it the most.
Yeah.
And in general, I would say the answer would be to literally kind of let yourself go, curl up into a ball and just go down. Because trying to stop that fall, outstretched hands, that's one of the number one causes of injuries is when you try to stop the fall.
Yes.
So, I mean, of course, falling backwards, you could hit your head or something. You can't necessarily control that. But even in that circumstance, if you have the presence of mind to, you know, just kind of give in to the fall, you may still protect your head by curling up a little bit.
Yeah.
But anyway, I would say that would be my number one recommendation if you can help it, is try to curl up into a ball and fall down, and that way more of the force is absorbed by the body instead of the limbs, which you're going to have a lot more chance of injury. If you have an arm outstretched or something like that, you can sprain the wrist or fracture the wrist.
Yeah, and see, I found that really interesting because when I was little, now I am from the country, so they do stuff different out there. But when I was little, they always told us to, like, you know, our family and stuff, like, put your arm out and break your fall. And so it's interesting because you really do break stuff when you do that. But it's interesting to kind of hear that it's better to protect yourself by rolling in a ball, but it makes more sense than putting your arms out and risking that injury.
And honestly, our bodies are, I mean, naturally speaking, our automatic reaction is to stick an arm out.
Yeah.
It's protective extension. Even an infant knows if you're sitting up on your own, you're about to fall over, put the arm out.
Yeah.
So that's what happens. But, you know, it's kind of that's kind of the gut fight or flight reaction.
Yeah, but not the safest thing.
Right. If you have, and again, it's hard to plan that, but
but just have it in the back of your mind.
Yeah. For sure.
Also, nurses are staying in the workforce longer, and we are aging, and you know, staying in there longer and longer due to the nursing shortage. What can we do to stay healthy?
Well, I think that I was going to praise you because I think the movement you started was great with Fit Nurse.
Yeah.
I think that's a big need that isn't being met, and you being an RN, of course, are in a perfect position to recommend that. And you understand that position of working 12-hour shifts, and even if it's an 8-hour shift, but it's home health, or you know, it's hard on your mind, your body. And so I would say that staying as active as possible is one of the best answers. Especially on the days that you aren't working. If you're working 12s, those days when you aren't working are still important to tap into activity and treating your body as kindly as you can, but also challenging yourself. So exercising in some way, shape, or form, and you know, you don't have to be a gym rat to exercise. You can walk 30 minutes a day. You can do some light weights. Just physical activity is what I mean. So just being active, but especially exercise that does challenge you if you can do that. Sleep hygiene is something else. And I've never experienced night shifts, but I know that they can be really hard on you. Just because of that, you're having to transition to a different sleep schedule, and then on your days off, you're not on that schedule. So, and even if you're working days, if you're doing 12s, you're probably getting up pretty early to start the shift. If it's a hospital, you're probably going to be arriving at 6:30 in the morning potentially, and not leaving until 6:30 or 7, probably more like 7 or 7:30, depending on how your handoff went.
Yeah.
I'm not using the right term for that, but you know what I mean.
Yeah, like
report, how your report went. But yeah, I mean, definitely trying to let your body rest on those days off, but you also want to keep that physical activity going as well. And even on the days that you are working, if it's possible to do exercise on those days, by all means try to do it. Which I think in your program, didn't they have times early and late for that reason?
Early and late, like scheduled around like when you get off work, so you can, if you work night shift, you can come get your little 20-minute workout, and then you're done. Or if you have an 8-hour shift, or you want to come in the evenings, we have those too, and then afternoon Saturday classes. And I did want to touch back on what you said about sleep. Don't just assume that you're a night person. I had always assumed that. I worked a night shift the first several years that I worked, and even through high school. And I, for some reason, switched to days, got a daytime job, and once I switched, I slept well. I didn't have as many headaches. I wasn't as tired. I wasn't eating as much. So don't, just because you always done it doesn't mean that's the best thing for your body or that you're a night owl. So yeah, I just wanted to touch on that.
Yeah, that's a good point. And also, like when I say sleep hygiene, like, you know, I don't know what people's habits are, but I know I've known some other nurses that they'll get off of those 12s or even 8s and just crash on those off days. Yeah. Which I can understand that, because it's, I mean, it's a high stress job, and you're doing 4 12s. Yeah. 3 12s, 4 12s.
It's usually 3, but if you pick up
3 12s,
but if you pick up extra, it's like 4 and 5, and ends up 48, 50 hours a week. So yeah.
Double shifts and stuff, yeah. So it's very easy to crash, but you know what? I would, in my mind, that's almost, to me, is kind of similar to getting over jet lag.
Yeah.
If you're going to Europe, if you've ever had the privilege of traveling to Europe, which I've been twice, whenever you're going over, if you don't get some sleep, it's going to be miserable. I mean, even an hour can literally make a difference. An hour or 2 on the plane, because once you get there, you want to stay up as long as possible.
Yeah.
You do not want to nap, because if you nap, you will not sleep for days.
Oh,
so yeah, I experienced that the first time.
Oh, that sounds awful.
Yeah, I took a nap and it was horrible. It was like, we were like 4 or 5 days into the trip, and I was still waking up at like 2 in the morning.
Oh my God.
Yeah. Try to have a normal routine where you're not just crashing for 12 or 13 hours. I mean, you could literally sleep for a day probably. Yeah. Just try to keep as normal of a routine as possible.
Like every day.
Yeah. But yeah, I guess the one thing I was going to say to tag onto that was that good sleep and exercise, we've been talking about those 2 things, and what that's important in is stress reduction. Stress reduction is going to impact how you heal, and I don't mean healing from like a cut, I mean that's true too, but just your regular tissue healing, and the turnover of cells and things like that.
Yeah, because it's like when you're highly stressed, you have like more free radicals in your body. Right?
Exactly.
Yeah, and those kind of attack your own.
It's hard to keep weight down because of cortisol in the bloodstream.
Yes.
So that helps, that I shouldn't say helps, it promotes weight gain because of basically retained blood sugar and fat and things like that. So oxidative stress and cortisol and things like that, that's going to help your body to be under a constant state of stress even when you're not working. And so reducing stress is really important, and it also reduces your chance of injury when you're less stressed.
And then another thing, so the age range from 45 to 54 has the highest risk of injury for nurses. What can they do to prevent injuries?
So honestly, that kind of falls right into what we said before about exercise, because or physical activity, because whether somebody's 25 or they're approaching 55, that physical activity is just as important or even more important in that age category, because you're preparing for you're preparing for getting older. And I joked in my notes that you know, once you get past 30, it seems like you can sneeze and pull a muscle in your neck or
swear.
your shoulders or something. So like
I can relate.
exercise helps to prevent things like that,
Yeah.
just because your tissues are moving better. Your again, stress levels are reduced, and less likely to happen if you're working on flexibility, strength, aerobic capacity, and a balanced lifestyle. That kind of ties into the how you're eating, sleeping, and things like that. So it is easier said than done. I'm definitely guilty of not taking care of myself as well as I should.
Me too.
I'm doing okay, but definitely I could definitely be doing better. So full disclosure on that. But certainly it's definitely important. Certainly it's important to continue to take care of yourself. Something we didn't talk about in all this that I didn't write down was hydration.
Yeah, it's like we don't like, I don't drink a lot when I'm doing 12, and then when I do drink, it's probably not water. That's not
Yeah,
bad.
that's something I didn't think about before just now, but that's really, really important. And it's really hard. I can understand why it's hard to drink water when you can't go to the bathroom.
Yeah.
You don't have time.
Yeah.
Because you're always being pulled 10 different directions.
Yeah.
So that's actually tough. I don't have a good solution for that.
Yeah, and then like when you do, you go get like a soda or something. Which I've been doing better with my water. And then like a lot of times like at the workplace, like when I get home health, you can have your drink there all the time in your car, but you can't have it like out.
No.
Yeah, at the nurse's station and stuff like that.
It has to be in a break room.
Yeah, so it's kind of hard to get back in there. But I did want to touch on something that Mike did say about if you're already working on being physically fit and in shape and you do have an injury or something like that, you're going to get better a lot faster and feel better. And the only reason I really know this is because I had 2 wrecks a year apart. It was terrible. So the first wreck, I hadn't been working out, hadn't been doing anything. It was horrible. I got like a strain, a sprain. It was painful. Had to do physical therapy and they call it therapeutic massage, but it was not fun at all.
She's right. It's
yeah,
when it works, it hurts sometimes.
Yeah, but it did help. But a year later, like almost a day, I got in a wreck, but I had been working out with the trainer for 6 months, and when I got in that wreck, I didn't need any physical therapy. I was waiting, like for that second day when everything was going to kick in, and I was going to feel like I was dying, and it didn't happen. So I can say that if you're actively in shape and something does like that happen, you'll feel a lot better, get better quicker, even if you do get an injury. So.
Yeah.
Okay, and then finally, Mike, what is your number one piece of advice for nurses in the workplace?
So I would say my number one piece of advice for y'all is you want to ask for help from others if you're ever in doubt about your safety or your patient's safety. Let's face it, that's patient care is where the injuries are happening, most often. And if in doubt, ask for help. Either that's other staff members, CNAs or other nurses on your floor, or use a lift. Don't be afraid to use a mechanical lift if a patient is too big to handle, because it's much better to be safe than sorry. Situations can go south really fast, especially with obese people. And I had a story to share about that. It's actually not so much related to my number one tip, but it's an example of how it takes a village sometimes.
Yeah.
There was a gentleman when I worked in the hospital and he was pretty young. I think he was in his 30s or 40s, but he was severely morbidly obese, or super morbid obese, I guess is what they would call it. 700 plus pounds when he was admitted to the hospital. And he did lose some weight, which got him into the 600s, but he was so large. And he had been completely dependent before his hospital stay, but because of being in the ICU and not being able to get up, he got super weak fast. And it was fast, and it was a lot faster for him because of his body type, unfortunately. Not as much muscle. So anyway, when he got up to the hospital floor, they asked PT to come in, and that we just shook our heads like, there's no way we can do anything with him.
Yeah.
At first, but it took my manager and myself to put our heads together to basically say, we can't do anything with him in the hospital room, but we could probably work with him in the rehab gym at the hospital.
Yeah.
Because we had large therapy mat tables, the ones that go up and down, but you can literally get 2 or 3 people on them at once. They're really big. And so, but when I say it takes a team, don't be afraid to ask for help, because we literally had to use the help of the transport team, the nurses on his floor, and a PT assistant, and at least one other support staff that was helping us to work with this guy, because when he started therapy, he couldn't even sit up on the edge of the bed.
Oh, wow.
Yeah. And so this is a person they're trying to discharge home.
Oh, yeah, that was not going to work.
So obviously they knew they couldn't do that, so they kept him. But he couldn't go anywhere, and so he didn't have benefits for rehab. So it was, long story short, day after day, the transport team, and literally I remember 6 guys trying to help this guy turn over to transfer him over to the mat table, and it was just a huge ordeal. But they successfully were able to bring him down to the rehab gym. It got to where he could sit up on his own. He started standing up at the side of that mat table, because you can elevate it. And then he went from taking a few steps to, well, I think he ultimately walked 100 or 200 feet before he discharged with a walker. Yeah. And so he was able to actually safely transfer to a vehicle to go home.
Oh, wow, that's amazing.
So anyway, that's an extreme example. There was no lift in the hospital, or really almost anywhere in Tulsa, that was capable of lifting a gentleman that big. But it took a village to, without all those different team members involved, he wouldn't have even gotten up.
Yeah, so that's amazing. So teamwork definitely makes the dream work, and then definitely planning and being consistent and sticking with it. So that's amazing.
But I mean, even if somebody is capable of, like, let's say someone's 300-400 pounds, which is more than well enough to use a lift in most cases, if they can't do it on their own, just use the lift. It's there to save your body from having to do that, and it's also there for the patient's safety too, and your safety. So ask for help from others and use those machines, because they're there for a reason.
Awesome, yeah, and take time, because we always say we don't have time, but it's much better to take time to go get the lift. So this has been awesome. We have learned so much. I'm so thankful for Mike coming out, speaking with us today. I'm going to drop, if it's okay with him, I'm going to drop all of his notes in the comments so you can see them and read them. They are really, really good. Also, he specializes in older adults, keeping you safe and active, and you can find him at Hyland Physical Therapy at
www.hylandpt.com. HylandPT.com.
Awesome. So he always gives free consultations. So just go book that and see Mike. So thank you guys, and we hope you enjoyed this, and we will see you again.
Thanks for watching.